Hello and welcome to the University of Edinburgh's Research Insights. My name is Hazel Lambert. I'll be your host. This event is being recorded, but your camera and mic are off, so we can't see or hear you. And if you'd like to share with friends or watch again later, you can access all the videos on our website. I'm joined this afternoon by Professor David Porteous and Dr Chloe Fawns-Ritchie to hear how they've been gathering data about our individual experiences of the pandemic. David and Chloe, welcome.
Hello.
Hello.
Hi, David. Hi, Chloe. David and Chloe are going to give a presentation, and afterwards you can ask anything at all about what you've heard. So the Q&A box is open. Type your questions in there, try to keep them short, and you can upvote so I can see which are most in demand. And we'll have about 15 minutes at the end for Q&A. The COVID life, teen COVID life, and rural COVID life studies you'll hear about this evening all aim to capture people's experiences since our lives changed so completely last year. We're all faced with similar restrictions, but the impact they have on individuals and families can be completely different from one household to the next. So the COVID life studies are trying to capture and give voice to the reality of what we're collectively living through. Professor David Porteous is an expert in genetics, and he leads a research project called Generation Scotland. It's a population study where people volunteer information about their lives and share their genetic information so that researchers can look for links and try to better understand what influences health overall. And Dr Chloe Fawns-Ritchie is a researcher in the Department of Psychology and the Generation Scotland lead on questionnaires. This means she's designed the questions and content in the COVID life studies and is going to share with us what they've learned so far. We'll hear from David first, then Chloe, then back to David again. So David and Chloe, when you're ready, over to you to start screen sharing, Chloe. Thank you.
Okay, so COVID-19, weathering the storm. I'm going to start and tell you a little bit about Generation Scotland before we dig into the COVID life series that Chloe is going to tell you about. So in the next slide, what I thought I'd like to do is just point out one thing, that it's Chloe and me today, but it could be any member of the team. It's a team science from start to finish. You've got a photograph up there on the left of the team as we were before lockdown. But the other thing I wanted to just say is that during lockdown, we've invited 6 other people to join the team, and some of us haven't actually met each other in person. So that's required quite a lot of new talent and skills to continue our research. And I'd also like to just say that for everyone who might be listening into this to find out more about the science we're doing but doesn't come from a scientific background, that's true for some of our teams. So there are people that are coming from a completely non-science background, but they're lending their skills to this project, and it really matters that we've got this multidisciplinary, multi-talented team. The next slide just tells you a bit more about Generation Scotland. As Hazel said, it's about the genetic, the inherited, and the environmental, the nurture influences on our physical and mental health. To date, we've got 24,000 participants. They're in about 7,000 families, and we recruited them between 2006 and 2011. Until now, it's been an adult-only study, but we're changing that. And the next slide just tells you a little bit about why we're doing this. The first thing to just say is that each family tells its own story. Their medical histories are unique, but very often we find that things that are common to one person in the family are seen in others in the next generation. The reason we want lots of different families to take part is that all the families together tell Scotland's story. So our mission is to improve the health and well-being of current and future generations. And our promise to volunteers is that we will value their participation, we will keep their information safe, secure, and private. We will tell them what we find, and we'll listen to what matters most for them. And with their help and trust, we aim to gain knowledge, to detect health problems early, to share what we discover widely, and to use that to influence healthcare policy and improve lives. The next slide just says a little bit about how we do this. It's absolutely dependent upon the NHS in Scotland, which collects all sorts of information on us from birth to death. And in so doing, we will do that through the GP visits and our hospital visits. It will be contained within samples that are taken for analysis, and it ends up in the form of a bag of prescriptions to treat whatever condition we may be suffering from. Now, that information is very precious, and it's kept very safely and securely by the NHS in Scotland. What we do on the left-hand side is to invite people to help us learn even more about conditions that they've suffered from and their journey through their medical histories. So we collect information about all sorts of different things. It could be heart disease, it could be mental health, and we add to that information about the material that they have inherited from their biological parents, DNA, and what that can also tell us, something that isn't done routinely within the NHS. But put the two together using very sophisticated ways to keep each data set separate, but allow them to be joined up so that we can analyze both NHS data and Generation Scotland data. And we have the equivalent of 200,000 person years worth of health data. That's in the form of tens of millions of data points. And our job is to keep that very safe, very secure, and recognize just how very valuable it is, and to create this trusted research environment and to be transparent about what we do for public benefit. That's our mission. The next slide just tells you about where we want to head next. So we are very fortunate to have got substantial funding from the Wellcome Trust that allows us to set out on our next journey, Next Gen Scot, which runs from 2019 to 2024 in its first phase. Now, we want to double the size of the cohort from the 24,000 to at least 48,000 or more in total. And that's because size matters. The more, the better. We also want to change the entry age for the study. We're doing this from age 12 and up. So that corresponds with children that are going into secondary school. And the reason for that is that adolescence matters. And it matters both as children, that transition from childhood to adulthood, but also as adults, because what happens in adolescence very often sets what's going to happen in adulthood, whether it's obesity or diabetes or some kind of other disorder, including mental health aspects. If we couple that with the NHS Scotland data, we can track health and well-being from birth to death. And we can supplement that, as we've done already for Generation Scotland, with online questionnaires, with health and well-being apps, so that we can collect data simply and remotely through smartphones. And also in this study, what we're doing is, instead of asking people to come into clinics for detailed examination, we're asking them to give us postal samples for genetic and biomarker analysis. And I'll say a little bit more about that later. But essentially, we're trying to make this study design as accessible to as many people as possible, wherever they live, and to introduce the opportunity to be part of it to younger members, the next generation. The next slide just reminds us that where we were this time last year, we were all set, ready to go. We'd done all the preparation, we'd raised the funding, we built the team, and we knew what we wanted to do. And then what happened? Well, the next slide says it all. COVID-19 has changed everything for us. It put our recruitment study on hold because, quite understandably, the priority for the NHS was that only studies that were directly relevant to COVID-19 would be looked at to check that they were sound, safe, and reliable. And for that reason, we sat down as a team, and over a period of a week of intense discussion, decided that we needed to change from our original plan to a completely new plan. And it's that Chloe's going to take over from me and tell you about.
Thank you, David. So although we were unable to carry out our Generation Scotland recruitment as planned, because we'd been planning to carry out online questionnaires, it meant that we were quite well positioned to turn our focus to carrying out questionnaires to understand how people were feeling and coping during the lockdown. And today I'm going to tell you about 3 sets of studies which we've carried out in the last year. And these studies are COVID life, teen COVID life, and rural COVID life. So here's a timeline of our studies, and the timeline starts March 2020 when the first lockdown was announced, and we're here today in March 2021. As you can see, we started collecting data in our various different studies quite early in the pandemic. It was about 3 weeks after the initial lockdown was announced that we started collecting information, and you can see that we've collected quite a lot of information all the way throughout the last year. In fact, we've collected information on 246 days of the last year. So that's over 2/3 of every day in the last year we've been collecting information from participants in at least one of our studies. Now, unfortunately, the pandemic is not over, and we are planning additional studies in the future as well. So the first study I'm going to tell you about, and the first study we set up, is the COVID Life survey. Now, we've all been impacted massively by the COVID-19 pandemic and the restrictions that were put in place to prevent the spread. But we're not all equally affected. There will be some people within society who are impacted more than others. So we set up the COVID Life study to try and understand the psychological, the social, and the economic impact of COVID-19. So our first COVID Life survey, we recruited just under 18,500 participants, and we've carried out 3 COVID Life surveys. So these are all on the same participants. They've come back on up to 3 occasions. We got about 11,300 in our second survey and about 10,500 in our third. Importantly, about 4,500 of those participants are also participants from the Generation Scotland study. What this means is that we can link the responses to the COVID Life survey with the responses that these participants gave us about health and lifestyle well before the pandemic. Most of our participants came from Scotland, and over 2/3 of the sample it told us that they were female. So when did we carry out our COVID Life studies? So the first COVID Life study took part between April and June 2020. So that was when we were in that first lockdown. We then carried out the second COVID Life study in July to August, which was when the COVID cases in the UK were relatively low and the restrictions had eased somewhat. And then we've just not long closed our third COVID Life study, which we collected in February 2021, which was again in another lockdown. So I'm going to tell you about one set of results looking at loneliness in our participants. Now, loneliness has been a very hot topic during COVID-19 because lots of people have been worried about loneliness. People, some people are living on their own. People haven't been able to see their friends and family much over the last year, if at all. So it is an important topic to assess during COVID-19. And we asked about loneliness in all of our surveys. So in the first and second COVID Life survey, we asked participants to tell us how lonely they were feeling during the last week. But to try and get a measure of how that's changed since before the pandemic, in the first COVID Life survey, we also asked participants to tell us how often they felt lonely before the COVID-19 measures were introduced. And participants could tell us that they felt lonely none, some, most, or all of the time. So this slide shows the results for how lonely our participants were feeling before the pandemic. So we asked them to think back to about January 2020. How lonely were they feeling then? The light blue here indicates people the percentage of people telling us that they are never lonely or almost never lonely. And the darker the blue, the more lonely these participants are feeling. So this very dark blue down here is the percentage of participants who reported being lonely all or almost all of the time. We've also separated the results here out by age. So the first column here is for participants aged 18 to 29. Then we have 30-year-olds, 40-year-olds, and all the way up to the right-hand side, which is participants aged 80 and over. So basically here, the more light blue, the better, because that's participants telling us that they're not feeling lonely. So remember, this is before the pandemic. what you'll see is that the percentage of people reporting not being lonely, or being lonely, being lonely almost never, varies by age. We found that the youngest age group, so those aged 18 to 29, were reporting being lonely more than the older age groups, and actually the lowest level was for those in their 70s. So this is before the pandemic. So how does this change during the first initial lockdown, so during the first COVID life survey? So the next slide I'll show you will be the results for during the first lockdown. Ready? There's a lot less blue. And obviously blue means that it's good, that means they're not feeling lonely. So during the first lockdown, all age groups reported feeling more lonely than before lockdown. I'm just going to show that again. So this is before lockdown, during lockdown. What this tells us is that there are higher rates of loneliness during lockdown than before lockdown. We still find that young participants, the younger age groups, are reporting more loneliness, but there's an increase in loneliness for all age groups. So what about in summertime, when the restrictions had eased a little bit and people could, at least see family or see some people? Do we find that the levels of loneliness dropped? Yes, we do. So this is in the summertime, just after the first lockdown had eased. And we find that the levels of loneliness reduce. So this is really good news. When we get out of a lockdown, loneliness levels drop. Now, they haven't returned to pre-lockdown levels, so they're still higher than they were at the start of 2020, but they're coming down. So the next study I'm going to talk about is the Teen COVID Life Survey. This was the second study we set up during the last year. Young people have been through an exceptionally challenging time during the pandemic. Schools closed, exams were cancelled, and there's a huge amount of uncertainty about their future. So we developed the Teen COVID Life Survey because we wanted to give young people aged 12 to 17 who were living in Scotland a voice to tell us how they were coping and adapting during the COVID-19 pandemic. We've carried out 2 Teen COVID Life surveys. In the first, we had just over 5,500 volunteers take part, and in the second, we had 2,200 take part. Again, we found that about 2/3 of the participants told us they were female. So when did we carry out the Teen COVID Life surveys? So the first one was carried out between May and July 2020. That was the point when most school pupils were doing their schoolwork from home. We carried out our second Teen COVID Life survey just after most school pupils returned to school for the first time since the start of the pandemic. And we're now planning a third Teen COVID Life study, which will run in spring 2021, and that'll be a year after we carried out our first study. One of the things we were especially interested in was finding out how much COVID-19 had changed the daily routines of our participants. And on the left-hand side here, we have the results for this question in the teenage sample, and they could choose between not at all, a little, some, and a lot. 63%, so that's about 2/3 of our young people, told us that COVID-19 had changed their daily routine a lot. Very few reported that it hasn't changed their daily routine at all. Only 2% said that. This question, we actually also asked our adult participants in COVID Life, and we can see the results for that on the right-hand side there. What's really striking is that the results are almost identical for the teens and the adult participants. And why I think this is really interesting is there was a huge amount of research carried out looking at how people are coping during the pandemic, but it's almost all focused on adults. But what we find here is that teenagers were just as much impacted by COVID Life as adults were. And that's actually one of the reasons why we wanted to carry out our Teen COVID Life surveys. So as a researcher in psychology, one of the things I'm especially interested in are seeing how much people are following the rules around COVID-19. And we asked our young people about wearing face coverings. So on the left-hand side here, we asked our participants, how often do you wear face coverings in enclosed places such as public transport and in shops? Now here, we have the results separated out by age. So on the left, we have those aged 12 to 14, And on the right, we have those aged 15 to 18, and we also separated it out by sex. So the first column of each is for female participants, and the second is for male participants. So although we found that male participants were slightly less likely to report wearing face coverings in public places, overwhelmingly, our young people said to us that they really were adhering to the rules. 94% of the young people told us that they were wearing face coverings in public transport and in shops most of the time or all of the time. Not only did they tell us that they were adhering to the rules, though, they also told us that they were in support of the rules. So that's here on the right-hand side. So we asked participants to tell us how much they agreed or disagreed that people should be wearing face coverings in enclosed spaces. And 89% of our participants told us that they either agreed or strongly agreed that people should be wearing face coverings in public spaces. So young people are often given quite a lot of stick for not following the rules and therefore for putting people's health at risk. But what we were finding is not only are they adhering to the rules, but they're actually in support of these rules as well, at least when it comes to face coverings. So the final study I'm going to tell you about, and the last one we've conducted, was the Rural COVID Life Survey. Now, rural communities actually make up 17% of the Scottish population, but they tend to be underrepresented in health research. And that's partly because a lot of health research takes place in cities, in big cities, and getting to and from rural communities is quite difficult. But that problem is less of a problem when you're carrying out online surveys. Now, to make sure we were asking appropriate questions, we actually designed our Rural COVID Life questionnaire in partnership with those living in rural communities. So they told us what was important issues to them, and then we've included those into our questionnaire. So the survey was designed to find out how the issues that rural communities face have been changing during the COVID-19 pandemic. We had just over 3,000 volunteers take part, about 2/3 of the sample reported being female, and we carried out the study in October and November time. One of the things that the rural communities told us was especially important to them was having access and good, reliable, high-speed broadband. Now, during the pandemic, having good broadband has become so important. It's how many of us work from home, and it's how people keep in touch with their friends and family. So we asked our rural participants to tell us how good their broadband was, and 20% said they had poor or very poor broadband. But despite this, nearly 9 out of 10 of our participants who we asked told us that having high-speed broadband was extremely important to be able to work from home, and 2/3 said that it was important to be able to keep in touch with their friends and families. We also asked about various aspects of the community and how COVID-19 had affected it, whether it was not as good now, about the same now, or better now. And it wasn't all good news. So 5% of the Rural COVID Life participants told us said that governments and local authorities listening to rural communities was better now. But there was some good news. So 42% said that pollution levels were better now. 28% said that there was a strong sense of community was better now, and 31% said that shopping locally was better now than it was before. So although we faced all these challenges, it does seem like there are some positive things that have come out of the last year. So that was a really short look at some of the results from our COVID Life studies. I can't possibly show you them all because we've got quite a lot, but if you're interested in learning more, you can go to our Generation Scotland website and we have more detailed reports there. Now, we're now planning to try and get back on track with our Next Gen Scotland work, and we're also trying to incorporate our COVID Life studies into our Next Gen Scotland work. And I'll now pass back over to David, who'll tell you a bit more about our future plans.
Thanks, Chloe. That's great. And yes, there's a wealth of information. We're still sifting through it, but there's a lot that we've learnt. And it's been fantastic to see how many people who've answered one questionnaire have gone on to answer a second and a third. And we really appreciate that because it really helps to see how things change over time. Just to go back a little bit and say what we've been doing since 2006, when we started up Generation Scotland. Since then, we've published over 250 research papers, They're all available online. We put them onto our website and you're welcome to read them. Some of them are a bit dense, I have to admit, but we do try to provide summaries and we do try to provide updates of general findings. Very often the research we have done in the past has been in collaboration with others. In fact, the last year has been our busiest year yet. During that year, we've published on work to do with cancer, with colon cancer and with breast cancer, with various aspects of heart disease, a lot of work on dementia and aging research in general, and on mental health, particularly around depression and anxiety, as well as the COVID-19. So it's been a full year, and speaking for myself, going back from partial retirement to working full-time has been pretty much essential. If you go to the next slide, Chloe, then we can tell you just a little bit about some of the other directly relevant work in terms of COVID-19. We've collaborated with a wonderful group based in London and also in Berlin, who've developed an extraordinarily smart way of looking at mere droplets of blood and processing it in a way in which it's possible to build up a fingerprint of all the proteins that are being expressed in the blood at any particular point in time. And they've used that to look to see whether there are any patterns in the blood proteins that it's different between people who are very severely affected by COVID-19 infection or moderately affected or not at all. And you can see that in that little plot in the middle under data analysis. The fact that there's a yellow box, an orange box, and a red box showing the way in which a subset of proteins, 27 in total, vary depending on whether an individual is mildly affected, moderately affected, or in red, severely affected. So these markers could be used to predict disease severity and trigger action on the part of clinicians to get all of the best quality treatment up and running as soon as possible if they see that somebody is at particularly high risk of being severely affected. So that's been very satisfying to be involved in helping with that study, and we're going to do much more with that group in the future. The other one was just before Christmas. A team from Edinburgh, led by Kenny Bailey, came to us and asked if we could help just provide some supporting evidence around their work, looking to see whether there were specific genetic factors that were leading to increased risk of severe hospitalization after COVID-19 infection. And through that study, 4 genes were identified that consistently popped up as ones to watch out for. One of those genes makes a protein which is a potential target for an existing anti-inflammatory drug. You've probably heard about the dexamethasone story about finding an existing drug that turns out to be very helpful in reducing severe effects of COVID-19. Well, this is another one. It still needs research and studies to check out that that's the case, but it's another encouraging potential addition to the armamentarium of treating COVID-19. And then the bottom panel, you'll see me, well, my bald head, I should say, and Chloe, and in the middle, Rachel, another member of the team. And we've all been testing a new technique that we hope to be able to ship out to our participants to see whether or not they have been exposed to COVID-19, developed antibodies, but haven't suffered any signs and symptoms of the illness. It's all packed into a little cardboard box, and when you open it up, all the tools that you need to do the study are there. It involves a little finger prick with a lancet to your finger, and if you see the panel with me, a drop of blood is going into a tube. You cap the tube, turn it upside down, pop it into the envelope, post it through a letterbox, and it goes off to a special lab which will analyze the results and feed them back. That's something that we're going to be rolling out to our Generation Scotland participants later in March or early April. I think the next slide really just also reminds us that we are now back on track, because we've been working very closely with our Research Ethics Committee, which reviews all of our plans for research and makes sure that we've got everything properly set up, and everything is being done in a very safe and secure and well-regulated manner. So actually our plans remain the same as they were exactly a year ago, but we have learned a lot from COVID-19 and our COVID Life survey. So I think we're confident that we're going to do a better study as a result. It's very clear that there's a huge public interest in being involved in research, and the people that get involved in research really get engaged, and they can see that there is a benefit to the population as a whole. And we're very encouraged to see that coming through the COVID Life surveys. So we've got our ethics approval for online consent and recruitment, and this is actually for 12-year-olds and up. This is a UK first. No one else has actually done this. So we're very excited about starting the study. We're ready to restart, and we'll be doing so in phases from spring 2021 onwards. And through that study, we hope to be able to link up the medical records with information that we can glean from saliva samples or blood spots, to do genetic studies, link it all up to the wonderful NHS records, and to collect additional information on smartphones and the like. I think the next slide really just wants to show our gratitude to the team on the left, Archie Campbell down to Christine, a large team now all working together, and to acknowledge also the co-investigators with me on this project, Ian Deedy, Caroline Hayward, Andrew McIntosh, Ricardo, Marioni, and Kathy Sudlow. We've had very generous support over the years from the Chief Scientist Office, the Scottish Government, Medical Research Council, Health Data Research UK, UKRI, and in particular the Wellcome Trust, who are paying out all of the money for all the staff and all the studies. And of course, a lot of this work is done in partnership with others. And we've built some fantastic collaborations with other groups around Scotland and beyond into the UK. And we hope to work closely with them in the future moving forward. And the last slide, I think, is to actually say thank you to all our participants. Without families, without willing families participating in this study, we just simply can't do it. And we're looking for many, many more, and particularly those with younger members, to set up Next Generation Scotland and really build a study that can help us understand what are the most pressing concerns for the health of our young people, as well as our adults and older people. And with that, to find out more, go to our website, follow our Twitter, Instagram, and Facebook pages. And last, if you're interested in finding out more or becoming part of Generation Scotland, do go to our website where you can register your interest, and we'll be in touch soon. With that, it's a big thank you for listening, and Chloe and I would be very happy to answer any of your questions.
Fantastic. Thank you so much, David. And Chloe, if you would stop sharing your screen now, then we'll see both your lovely faces close up. That's great. Thank you. David, thank you for staving off retirement. That sounds like you're doing us all a favour. Questions are coming in already, and the most significant thing and top question at the moment is, how do you share your survey findings? Like, why is it so important that you can capture all this? Can you share it with government? What do you do with the information that you've got? David,
Chloe, do you want to answer, or do you want me to?
I'll certainly have a go.
Off you go, Chloe.
Yeah. So one of the sort of Generation Scotland ethos is that we will share our findings with our participants first and foremost. So we always try with the COVID Life studies, and then going forward with our next generation recruitment, is very important to us that we the first people that will hear about the results are the participants who took part in the studies. And that's what we've been doing during the COVID Life studies. So whenever we carry out a study, we'll write up a report. Sometimes it's quite short, sometimes it's more detailed, and we'll send it straight out to the participants. We then put it on our website as well, and we try and share it as far as wide as we can. So we've sent it to people from the Scottish Government, we've sent it to people who do other research who might be interested in it. And we are also writing academic papers, so peer-reviewed papers using this data. But one of the problems about peer-reviewed papers is that they are quite time-consuming and it takes a long time to get published. So it's always important to us to get those reports out first before we're writing the academic papers. And David, are there other people that we've been sending our surveys to?
I think that's a great summary. I'd just add that we make a point of trying to have a one-page infographic that gives you the big news, and then a longer piece that goes into the findings in more detail. But yes, we've made a very conscious effort to say that our job is to act as a means to do research well, do it quickly, and share it as fast as possible. The academic papers at the moment just have to wait. However, the other thing that this has done has been to raise awareness of what we've been doing nationally. And as a consequence of that, Generation Scotland has been asked by the Wellcome Trust to share our questionnaires with others, which we've done. And so we now have, jointly with a group in Bristol, who run the LSPAC study, the Avon Longitudinal Study of Parents and Children, the two of us have come together and we've provided questionnaires to well over 60,000, to well over 10 different cohorts, who in turn have put the questions out to well over 60,000 other participants. So it's providing leverage for others, and there is no point in anybody starting from scratch when they can come to us and borrow what we've learned.
There's value in that, isn't there? Because it means data is consistent.
Yeah.
For everyone watching, Wellcome Trust is a charity that funds a huge amount of the medical research in the UK. It's a big deal if you get funding from Wellcome. And one of the things that you said earlier in your presentation, Chloe, was about loneliness, and you were measuring how lonely people were. Why does it matter? Why is it significant that you're measuring loneliness?
I think, firstly, it's important. Feeling lonely is not nice. So it's important to assess loneliness because it's not a nice feeling, and therefore it's important in and of itself. But being lonely is associated with a huge number of different health, mental health and physical health outcomes. So, for example, those who report being more lonely are more likely to have conditions like anxiety and depression. They're also more likely to suffer things like chronic pain. They have heart problems. They're more likely to develop things like dementia. And actually, they're more likely to die earlier as well. So it's an important topic because it's not a nice feeling, but it seems to also be associated with a huge range of different health outcomes. And that's why there's such a focus on it. And I think that's why there's been a focus on loneliness in older adults, despite the fact a lot of the research before COVID and now shows that actually it's young people who report feeling lonely more often than older adults do.
That's what I was really struck by. And we've got the questions are coming in thick and fast here in the Q&A box. So let's go for the one at the top, which is about ethnicity of the people who are volunteering their information. Do the results that you have vary according to the ethnicity of the people who are responding? Does it matter?
Well, one of the things, can I, well,
on you go, David, on you go.
Go on. Earlier today, I was on a meeting that was really focusing exactly on this. In Scotland, we do have a lot of different ethnic groups. However, they are small in number, and we have to recognize the fact that for this study, most of our respondents, the vast majority of our respondents are report as being British white. However, one of the great advantages of the work that we've been doing is that we have been able to partner up with other groups in the UK who are collecting information from other parts of the UK with a much higher proportion of people from Black, African and Asian heritage. And by combining forces, we're in a very strong position to address these questions. And indeed, as I was saying earlier today before coming on here, we had a meeting to discuss exactly that fact. So we're able to do it, but only in partnership but we are always up for partnering up with other cohorts to just, again, add value and add insight.
That's where it is, isn't it? And it's the long-term nature of the studies that you're doing. When you started these COVID life studies, and even just the way you've done them, the fact that you're working in partnership with rural communities is a really strong foundation to build on for the future, isn't it? Chloe, could you tell us a little bit about that? That you said that the questions in the rural COVID life study were actually designed with people who are living rurally. How did you do that?
So we actually employed someone specifically for this purpose. So we had Ali Forbes join the team when we were planning the rural COVID life survey, and she basically went out to different rural communities, different organisations, and the first thing she did was ask them what's important to them. I think as a researcher, things that are important to us as researchers are not necessarily what's interesting or important to the people that we're carrying out studies on. So it was, especially important with, we all live in a city. You don't want to assume what rural communities are, what problems they're facing. So Ali went out and asked them, and to be honest, a lot of them were the sort of things we were thinking about. But there were certain topics that the rural communities really wanted us to assess. So things like travel, transport, things like that. But the point they made was that these were issues that they already had. These were not issues that have gotten, that have developed in the last year. These were issues that they've already faced for the last however many years. And it's about how those were changing over time. Okay. And without that, they were, these rural communities really, organisations played an integral part into designing the rural COVID life survey.
And building on that, we've got a question here about whether there was anything that surprised you when you sat down and you looked at the data. In any of the studies, was there anything that came out that was a big surprise?
I think the biggest surprise for me was, there's two I'll talk about. So firstly, I talked about the teens being so adherent to the guidelines. I think that surprised me a bit. And I think part of it was there was a lot of sort of press and media around how teenagers weren't following the rules and how that was putting people's lives at risk. And so I assumed that we would find that the young participants weren't following the guidelines, but they were, and they were following them just as much as our adult participants were. So I think that was a bit of a surprise. And I think the other thing that surprised me is that some people have actually quite enjoyed the last year. There have been definite positive things about the last year. We've had participants telling us things like, that they were learning new technologies, taking on new hobbies. People were taking up old hobbies that have long been forgotten about. So although it's been an extremely challenging year, and for some people it's been an awful year, but I think it's important to recognise that there might be a few positive things that have happened in the last year that we should try and maintain going forward.
Yeah, that we should carry with us. And that's a nice note to almost end on, actually, is everyone, make a note of the things that have been good about this year and that we can carry on doing in the future. We've got time for 2 more questions. So I'm going to ask, the top one here is about mental health in young people. In your surveys, did you look closely at mental health in the teenagers in the teen COVID life study, beyond loneliness?
Yes, so we did. So we asked, we looked at things like well-being in young people, and what we found is that the levels seem to be a little bit lower than what other studies have found. So it's important to point out that we don't have a measure from before lockdown, but we can compare our study to sort of previous studies. And it does seem that well-being rates are a little bit lower in our teenage participants than we would expect. And that's something we're going to track over time. So in each of our teen COVID life and the other COVID life studies, we give the same measures across time, and that means that we can try and see how it's changing, because we've now got the situation where we've had one lockdown and then the restrictions have eased, and then another lockdown, and then we assume the restrictions are going to ease again. So it will be interesting to see how mental health tracks over that pattern.
We've just had a brilliant question come in, so I'm actually going to ask 2 more. Do you think people tell the truth when they answer surveys like this? David, I'm going to put that to you. Do you think people are honest when they fill in the surveys?
Obviously this is one of the things you have to say when you devise these questionnaires is to say, please answer as best you can, and also to ensure that it's unequivocally the case that this will be a confidential questionnaire, and that's crucial. I think that most people actually do try to answer very honestly, because we've promised that there's not going to be any disclosure of personal information. And I think once they get engaged in the process, and I think we can measure that by virtue of the fact that so many people that answer the first questionnaire come back and do the second and the third. So once they're in, they've got a level of commitment, and there's no, I think that tells us that it's highly unlikely that they're going to be saying something untruthful or claiming more than you might, or trying to give the right answer. And I think this actually comes down to the psychology of the questionnaires, and there's actually quite an important science about how you design the questionnaire, which is Chloe's area of expertise. Framing the question so that you've got the right number of options. And if you stop and think, am I feeling okay, a bit worse, or a lot worse? It's much better to do it that way than to just say, do you feel worse or better? You know, you give them the opportunity to stop, think, and then answer the question. And I think the evidence overall is that most people do answer very honestly. And actually, one of the ways that you try and address that is by having more or less the same question rephrased more than once. And you ask for what's the correlation between the first time you've asked that question with the second time. And that acts as a kind of a check.
There's a lot of thought that goes into the survey design, and it's based on psychology.
It's worth also pointing out that none of the questions in our surveys require an answer. So if there was a specific topic somebody didn't want to answer about, they don't have to.
Yeah, that makes sense. I'm going to ask you both one last question. Chloe, if you would answer first, it's what would somebody need to study to be able to do your job? How did you get there?
So my background is psychology. So I did my degree in psychology, and that my research interests are all about understanding behaviour. So and obviously designing questionnaires. But it's a good point that there are a lot of varied people on the team.
And David, how did you get your job?
How did you get my job?
Or what did you study? What's the path you've taken?
Well, I will just go back first to just say the team comes from all sorts of different directions. We've got we've got literature graduates, we've got a creative industry person leading the rural COVID life. Me, I came to university in Edinburgh, did biological sciences, got completely bowled over by the beauty and elegance of genetics, studied that. First of all, in fungi, for goodness sake, but then moved into medicine, medical research, and I've done all my research since then has been in medical research, including gene therapy for cystic fibrosis, psychiatric genetics, looking at schizophrenia and bipolar. But for the last 20 years, it's been Generation Scotland, Generation Scotland, Generation Scotland.
There we go.
This is going to be my swan song. Yeah.
From mushrooms to the elegance and beauty of Generation Scotland. I like it. Thank you both so much for joining us this evening. Thank you to everyone watching for your questions. Thank you to Nick and Jen who are making everything work beautifully in the background. These events are our way to share the latest in research with you. And throughout the winter, our audience have given us fantastic suggestions for what our final event should be about. 3 themes have come up most often: COVID, climate change, and neuroscience. The COVID questions we've covered a few times, but I will update the event listing with some links to animations about how vaccines work and about how immune response is generated. And we're already planning some climate change events to line up with COP26 in Glasgow later in the year, which means that our final event on 24th March, we're going to hear from some fantastic neuroscience researchers. I'm just working on the lineup, but it's looking like it's going to be a good one. I'll be back next week with colleagues who are running the COVID and pregnancy study to hear how they've approached it and why it's so important we can try to understand what kind of risks COVID infection creates for pregnant women. So for now, thank you. Take care. I hope you're cozy at home and you can join us again in the future. Bye.
Thanks, Hazel. Bye.
Thanks, Chloe. Thanks, David.
Thank you. Bye.
Take care.